Hello everyone, my name is Paisley Roberts and I'm Michelle Miles, Occupational Therapy Level 2 Fieldwork student. For my fieldwork project, what I did was create a binder for Abby and Kismet that is called Abby and Kismet's Book of Animal Assisted Occupational Therapy Tools. And this binder is full of animal assisted evidence-based practice as well as pediatric occupational therapy interventions. So on the first page here, I put a general definition for animal assisted therapy, which can be defined as the use of an animal within a goal-directed intervention to promote physical, emotional, cognitive, and social function. I go on to explain a little bit about common pediatric diagnoses that pair well with animal-assisted therapy. I won't read all of them, but a couple of the main ones are ADHD, autism, any developmental delay, and anxiety. I go on a little bit more in depth here about evidence-based practice in not only the pediatric population, but also multiple other populations for animal-assisted therapy. Again, I won't read these articles because I think you're getting a copy of the book in a Word document. So if this interests you, you can always go and read a little bit more about it. I have 4 different articles that range from pediatrics all the way to elderly. And then I go on to talk a little bit about how can animal-assisted therapy help a pediatric patient. So I list some things here. Again, I'll just read a couple, but you can improve problem-solving skills. You can teach a patient to relate to others. You can provide sensory integration, boost self-esteem and confidence, increase motivation and participation within interventions, as well as help a pediatric patient learn to self-regulate. And then I also go in and list a few different types of animal-assisted therapy interventions that could be possible to use with different pediatric patients at Jones. So again, I'll just read a couple because there's quite a few here. One is to have the patient complete a brushing sequence. This would promote sequencing, emotional regulation, initiating of a task, attention, bilateral coordination. They would have to start at the head of the dog and brush all the way down across and crossing midline, as well as terminating a task, when to know that they were done with one brush and to move to another one, and just to provide general sensory integration since there is that tactile input from the dog's fur. Another example is to create an obstacle course on the floor, which Abby can make with tape or with different tools that we have here at Jones, and have the patient navigate it with Kismet to promote problem-solving skills, as well as increasing self-confidence and increase general participation in interventions. And again, there are several others that you can look through in the Word document if this interests you more. And then I left some room here in the binder for Abby to put her own interventions as she develops new ideas. And then the last page of the binder is just of my references. But I chose this project because this is something that interests me. I've always loved animals and I have a background with horses. I would love to work with an animal-assisted therapy program, if that is hippotherapy or just canine-assisted therapy. So I'm very interested in both of those, and that's why I chose this project. But thank you for listening, and I hope you enjoyed.